Before beginning effleurage, it's important to begin with opening the restriction points, first centrally with the thoracic inlet. That can be done with a articulatory technique, which you have already been taught, or potentially a myofascial technique as well, your choice. Begin with the posterior axillary fold, proximally, working your way distally. So the posterior axillary fold is approximated with your hand and thumb reaching into the axilla to get as much of the posterior axillary fold in your hand, and then an inhibition or compression force is applied with that hand. The arm of the patient can be returned to the side of their body for comfort, and as the release is felt, further compression inhibition can be applied. Then you can go to the anterior axillary fold, which can be provided in a similar manner with that compressive force and inhibition. Once the axillary folds have been addressed, working towards the antecubital fossa is important. Now I'm going to orient the patient here in an unusual way just so you can see the finger placement in the antecubital fossa. So as you can see, the four fingers on each hand are meeting in the midline of the fossa, and then the actual technique would be performed with the patient's arm either at their side or if they're seated, allowing some gravity and traction. But again, the force of those fingertips moving posteriorly into the fossa towards the olecranon. Similar technique idea of inhibition or compression, and when no further release or change is noted, then moving distally. At this point, we come to the transverse carpal ligament, and here, this similar technique that we did to the antecubital fossa would be quite painful because of the proximity of the nerves and tendons. So instead, grabbing the hook of the hamate, pisiform, and tubercle laterally, you can then take your thumbs, if I orient just a little bit more, external rotation, opposing your thumbs, providing traction on the transverse carpal ligament. You can also put the hand in a dorsiflexion to accentuate that traction and stretch of the fascia, leading to hopefully greater expansion of room throughout the carpal tunnel. So moving from proximal to distal with the release of the restriction points.